Welcome. I'm Dr. Duke Majan. We're streaming live spine surgery on September 25th, 2025. We're in the process of figuring out the levels we're supposed to treat right now. Our patient has had spinal fusion, laminectomy before. All right, so just give me a second. I'm going to talk to my team. See that disc at the bottom there? That's 5-1. That's what I'm calling 5-1, okay? I don't think that's the one you're pointing to. Well, I think it's the one below. You see it? I think that's 5-1. There. Yes. Then 4-5. Then 3-4. Then 2-3. And then 1-2 is above that. You agree, Jordan? Because that disc is well preserved in height, and it's not a typical like front back. It's not the same as the other one. So that matches with what we're calling 5-1 on the MRI. But they're all in bad shape, all these discs. So if that's 5-1, then that 4-5 is probably one of his fused levels from before. And then you see the iliac crest right above that. Yep, that's the iliac crest. And then the one above would be 3-4, which is in horrific shape. Totally collapsed, degenerated, but no herniation. So that means we're trying to do the one above that. You agree? So then let's go to that and the one above that. Let's go to that one. Nice and slow shot. Where do you think it is? Right there? I think it's that one there. That one and the one above. You agree? Yes, sir. All right, so the bottom one, let's get it lined up. You see the orbit's off. You can see a weird pedicle shadow. Orbit's off shot. That's better. A little bit more, slightly shot. All right, now the wag is way off as well. Where do you think it is? All right, right there, yeah. So you can see the pedicle below looks beautiful. You got them lined up perfectly. But above is off because there's scoliosis at that level. That's why. So I think that's got to be where we keep it, right there. And that's the first disc we're going to fix. Okay, we're fixing 2 discs on the left. That is the number 1, 2, 2, 3. So we're going to make a num-num injection on the left. You ready, Dr. B? Little num-num. Sorry, some numbing medicine. Our patient is asleep with sedation. He's a big guy. He travels here from Nebraska. He is from Nebraska. And he's watched a lot of the DLDRs over the years and really likes what we're doing. Wants to avoid invasive surgery. Henry, can you see the incision here? Incision here, incision here. Guess what that's from?
Yes, we can.
That's from his laminectomy, okay? Folks, you see that? You guys see the laminectomy incisions?
Yes, we do.
Those are scars. He's already had laminectomy infusion. I'll mark it out for you. I'll put my line next to his so you can see the white. This is the incision he had before. Huge. They destroyed his muscle and his ligaments and his bones. So there is the actual incision from his fusion, and here's another one. Okay. These are about 6 or 7 inches each. Total is around 1.5 feet. We're going to do everything with a 7-millimeter incision. 7 millimeters. Again, he's from Nebraska. He's been watching our surgeries now for a while. He's very impressed with what we're doing here. Did not want invasive surgery. Did not want to live in pain the rest of his life. AP? So far, we're placing our needles. We're going to continue to do this for the next few minutes. So, Henry, show our audience the 30 different causes of back pain. Perfect. Dr. R. Duke Machen with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Machen. Thanks for joining us. And welcome back. You can see from our video shot that there are 30 distinct individual causes of back pain. This patient has 2 problems. He's got back pain, but he's also got leg pain, leg weakness, numbness, leg symptoms. He does not have a piriformis syndrome. I checked him. but he does have pinched nerves in his foramen. Shot. And they're big herniations in the neuroforamen, pinching the nerves. You can see it on that MRI, that AP that Henry's got for you down at the bottom. You can see these big herniations, big disc osteophyte. It's a piece of disc herniation plus bone spur, and it's on that both sides at L2-3 and just on the left at L1-2. All right, Jordan. Shot. Shot. AP. His spine is quite twisted. Uh-huh. I'm not crazy about that. I want to be a little bit more lateral. Shot. 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 When I say shot, I'm asking my team shot to take a picture with the X-ray machine. Is that it? Yes, AP. You can see from the X-ray at L2-3 that I'm right at the back of the disc with the needle. I have to verify that. It looks perfect on the AP view. We've already done the discogram. You can see the dye within the disc at L. Hey, you can be over there showing people stuff while we're waiting, while Jordan's whipping around. Go on.
With the mouse.
Put you to work. Yeah, there's the needle that I'm placing right now. Good job, Nikki. Show us the dye in the disc space. There you go, the black dye. And it's at the one above as well. All right, so I got to finish placing this needle on the right side. Shot. Just about done. And the reason I'm having difficulty getting in is because he's got a collapsed disc space. AP, I think we're just about done here. I'm right at the back of the disc. I'm happy with that. I can place a guide wire and advance the dilator with the patient more deeply asleep. It's perfect. Perfect, perfect, perfect. All right, very happy with that. We're going to get started with the Duke laser disc repair. Now you all saw the animation. It showed you, by the way, there's the blood loss for the whole surgery. That's probably 10 drops of blood. It's like a nosebleed. You all saw the animation that shot that goes through the 30 different causes of chronic back pain. Now, they're not equal, okay? They're not all equal. You can't, disc pain from a disc injury is by far the most common. As a matter of fact, 85% of all chronic back pain is pain that comes from a disc injury. Okay? Pain from a disc injury. I need a knife. And that's 85%, folks. 10%, so that gets us up to 95%. 10% of chronic back pain is pain primarily coming from the facet joint that's arthritic. This patient has that too. He's got disc problems, disc pain, disc symptoms, but he's also got facet pain. So we're going to fix both today. We're going to start with the discs and then move on to the facets later. Any questions?
At this moment, no current questions.
All right, great. You guys know everything. All right, take a look at the tip of the dilator shot. Nikki's going to do it. Right there, that's the L1-2 disc, L1-2. He's already had surgery at 4551 with onlay fusion done many years ago. He now has what's called adjacent segment disease, right? We've talked about that. When you have a fusion, the most common problem afterwards is wearing out the discs above and below the fusion, and those things start bulging and causing back pain and leg symptoms. That's what he's got. But he only has it on the left side at 1-2 and on both sides at 2-3. So we're only fixing the left side at 1-2, both sides at 2-3. Henry, let's show the audience how these disc injuries cause back pain, and more importantly, how we fix it.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922. Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Luis, welcome back. We are working on the herniation right now using the laser. I would grab another just to be ready. You think it's the machine or the fiber?
It's probably not a fiber. It's probably got little glass over there.
So machine or laser?
Oh, I think it's a machine. The little glass there. Probably.
Jordan, can you grab Grabzilla? All right, any questions?
Yes, we have a question coming from Ping on Facebook
Hi, Ping.
asking, "Hi Doc, with adjacent segment disease, will it come back after the DLDR or no?"
Great question. The adjacent segment disease does not come back Grabzilla after the DLDR. The DLDR is a permanent fix for adjacent segment disease. We don't get the pain coming back or any symptoms coming back. Great question. I'm going to use Grabzilla. He's got such a big herniation here. Oh yeah, look at that. You guys see that, Henry?
Yes, we can.
That's a big, nice big piece. Watch the fiber.
And then let's start bringing another machine just in case. Just put it back on just in case. Yeah.
Any other questions?
At this moment, no current questions.
So Grabzilla is a very special grabber. Unlike my other grabber where it just grabs straight, Grabzilla can be angled upwards. You guys see that? Upwards.
Yes, we can.
And that means I'm angling more towards the herniation itself. All right. Going back in, take a look at our handiwork with Grabzilla. Now, Grabzilla was the name given to that instrument by Dr. Anthony Young, Tony Young. One of my, look at that, did a nice job. Dr. Young was a faculty who taught me endoscopic spine surgery. Look at the inflammatory tissue. You guys see the pink color? Should not be pink, should be white. The fact that it's pink tells me that there's inflammation. And we keep talking about inflammation. We just showed you that video, right? With the inflammation. Straight. It's here. That inflammation is the source of people's pain that they get when they have a herniation. Okay? The inflammation causes back pain. It also causes sciatica. What makes the inflammation happen, if you watch the video, you could see that it's a tear in the back wall of the disc. That's where the inflammation happens. But it's not just a tear that causes the inflammation. You got to have a herniation too. So you need the tear plus a herniation to get the inflammation. He comes from Nebraska, right? I was asking him, what do you guys grow in Nebraska? He said, mostly corn. Mostly corn.
That's one of the few states you can watch your dog run away for 3 days.
Yeah. It's I've only heard good things about Nebraska. Wish I could retire there. Problem is, I can't retire. All right. So you see all of this is scarred up herniation right there. See the tear right there at 12 o'clock? You see the torn fibers of the annulus?
Yes, we do.
You see the herniation and scar tissue. That is granulation tissue that's pink. It's basically young scar tissue mixed in with old scar tissue. That's what we're seeing. All these are pieces of herniation floating up. All right, grab her. See that piece of herniation right there? It's got some pink on it.
Yes, we
some
do.
blue on it. I got to try to grab it out. You got a lot of pieces of herniation coming out. I can tell you that right now. I'm looking at them all over the place. They're just floating out. So what this guy did, this patient, he injured his disc. When he did, he fragmented that nucleus, that jelly. It broke into probably 100 pieces right by the wall where it was torn. Whatever he did to make that happen. And it's trauma. I don't know specifically what the trauma was. Could be a football injury, getting hit hard, on the line, tackled. But the point is, it's some type of a traumatic injury, Grabzilla, that smashes the disc, tears the annulus, smashes the nucleus, tears the annulus, and then you're left with this herniated fragments trying to sneak out of that tear. Look at that, another big cluster of herniation. You can see all the herniation here that's floated out. Any questions?
At this moment, no current questions. We're getting a spike in viewership, but no questions. All good, though.
Fine. You see all the pieces of herniation here?
Yes, we do.
Yeah, they just float out of the tube. So the laser releases them, and then the fluid in here, oh, that's nice. The fluid in here just floats it out. All right, that was good. That Grabzilla did a great job there. There's the crack. You guys see the crack, the tear right there at 12 o'clock? That is the annular tear. And you see all that inflammation there, that pink stuff? That is the inflammation I've been talking to you about. Very nice, very beautiful picture of that right there. That is where his pain is coming from, that inflammation. I got to clean it out, get rid of it. That's my job. That's what the Duke Laser Disc Repair does. We're the first in the world to do this treatment. I've tried teaching other surgeons about it, but they love doing their fusions. They get more money for fusions. Fusions pay better, for sure, than laser does. So that's why the surgeons aren't recommending laser, because they're making too much money doing fusions. They want that insurance payment. Any questions?
Yes, we have a question from Karsten.
Irrigation.
From Karsten on YouTube, asking, do you do any rehab or rehab recommendations for the patients?
We do. We have rehab for all of our patients, 100%. And that rehab is quite simple. It's literally a walking exercise program where they're walking twice a day, 20 minutes, and it's increases after 2 weeks to a mile. That's our rehab program. So, walking is the only rehab they need after surgery. No physical therapy, just walking. No chiropractors, no PT, just walking. You know, the problem is with chiros, PTs, they want to be aggressive. They like pushing patients, and sometimes they push a little bit too hard, and the patients end up re-injuring. Re-injuring their back. And I don't want my patients to re-injure their back. I've had it happen. Hold the tube. I've had it happen too many times. As a matter of fact, since we stopped referring people for outside therapy, my re-herniation rates have gone down to almost zero. Believe it or not. So, I want my patients doing therapy, but I want them doing their own therapy. Walking, swinging their arms while they're walking. 20 minutes twice a day, 2 weeks, followed by a mile a day after 2 weeks for 2 months. That's it. Very easy. All right, we're done here on the left at 1-2. We're going to move on to the 2-3 next. I just got another minute of cleaning up here, and then we'll be done. Any other questions?
Yes, we have a comment and a question. This comment is from Warren on YouTube,
Hi, Warren on YouTube. Welcome.
saying, Dr. Duke, I am 8 weeks from you fixing my 2 discs and piriformis. I am pain-free. Thank you, Dr. Duke. I am walking 5 miles a day.
Oh, wow. How many weeks?
8
8 weeks. All right. Good for you, Warren. So great to hear from you. Thanks for sharing your success with everybody. Great to hear. Keep it up. Enjoy life. And in a year from your surgery, you can do anything you want. No restrictions. We love to hear from our patients. So thanks for coming back and sharing your story. All right, just about done with this. You guys see the herniation, you see the scar tissue.
Yes, we do.
This is very abnormal. We don't see many normal discs because, well, to be honest, we're not operating on normal discs, right? Normal discs don't need surgery. So people ask me, what does a normal disc look like? You know, I'll be honest with you, I don't know. After 20 years of doing endoscopic disc surgery, I don't know what a normal disc looks like inside. I can imagine it because I've seen some parts of the disc that are normal endoscopically, like people with a small tear and a small herniation. I get in there and I can see the tear and the herniation, but I can also see the part of the disc that's normal, and it looks white, and it looks in like together, like as one piece. All right, that's beautiful. Yeah, just about finished. I might throw Grabzilla in there one more time. I think I will, since we've had so much success with Grabzilla. And I'll do a side-by-side for you die-hard endoscopic spine surgery lovers out there. You can see what Grabzilla looks like. Oh, man. That was a good bite. Look at all that junk that came out. Let's show Grabzilla versus the straight grabber. This is our normal grabber, and there's Grabzilla. You guys see the difference? Big difference.
Yes, we do.
Plus, Grabzilla is articulated, so it can move up like that and grab more medial to get those medial herniations, like I just did right then and there. All right, I think we're done. I'm going to take one last peek. A little bit of blood because we've been, grabbing stuff out. Now we got some pressure release on the epidural veins. A lot of scar tissue, but looks good to me. I'm happy. 1 down, 2 more to go. How's our patient, Berndes? All right. So what I'm going to do on this next one, I'm going to put the dilator in, open the disc space, and then I'm going to put the other needle in better on the other side. Does that make sense? You guys see all the pieces of herniation here
Yes, we do.
that floated out. That's one disc. That's it. I mean, that's crazy, huh? Hold on. No. I'm going to take this out first, and then I'll place the guide wire. Come on in, Jordan. So far, good. We've done the video. Why don't we show the audience? This patient is a prime example of somebody who's had open back surgery, invasive back surgery, laminectomy with onlay fusion. You guys see all the prior scars on his back. Okay, I marked them up for you so it's easy to see. Okay, there. And what I'd like to do is show you guys sort of a comparison shot of the Duke laser disc repair versus, say, laminectomy surgery. Okay, shot. I just want to let you guys see that difference. So let's show that video. Wait. Hi, I'm Dr. Duke Majan. We've just completed our free MRI review at Duke Spine Institute, and I've diagnosed you with discogenic back pain. The spine is made up of many bones and joints. It's the joints that are actually the source of back pain. The disc is by far the most common source of back pain, as is in your case. It is the cause of your back pain, the primary cause. In your case, the primary cause of your back pain is an injury to a disc in your lower back that's causing inflammation and hence back pain from the inflammation. Inflammation is the source of all pain in the body, whether it's a broken bone, whether it's an injured joint or an arthritic knee. Pain comes from inflammation. Inflammation is a process where your body is trying to repair a damaged joint, and it creates swelling, tenderness, heat, and pain. The pain you're experiencing in your lower back is primarily coming from a small tear located within the back of the wall of a disc. Now, I may have diagnosed you with more than one disc as the source of your pain, and each of those discs cause pain through the same mechanism. As you see in our video, trauma causes a tear in the back wall of the disc called a posterior annular tear. At the same time, it fragments the nuclear material just inside the wall, and over time, after the injury, you, through activities, push out small fragments of disc herniation into the tear, which then causes cycles of inflammation and pain. And that's why you're experiencing your lower back pain. At some point, your back pain could become permanent and not just reside in your back and not ever leave. But typically, people go through a phase where the back pain is cyclical, where it comes and goes, and activities are generally the cause of the back pain flare-ups. In your case, we can fix your back pain by performing a state-of-the-art procedure only available here at Duke Spine Institute. This is a minimally invasive arthroscopic procedure performed with a laser. This procedure is called the Duke Laser Disc Repair. We've been performing the Duke Laser Disc Repair since 2006 here at the Duke Spine Institute. To date, we've had 0 complications. The Duke Laser Disc Repair is the safest, most effective treatment for back pain coming from an injured disc like yours. We're recommending you consider the Duke Laser Disc Repair as your primary and main treatment option to get rid of your back pain quickly and permanently with minimal impact on your life. Recovery from Duke Laser Disc Repair is just 1 hour. You're going to go back to your hotel after the surgery. You'll spend the night in your hotel recovering, and then in the morning you'll come in for a quick checkup. The checkup usually takes about 30 minutes, and then you can go back home after the checkup. Alternative treatments to the Duke Laser Disc Repair are far more invasive, and the outcome of those treatments is far more uncertain. There are many surgeons offering treatments such as laminectomy, discectomy, spinal fusion, disc replacement. Other treatments include injecting materials into your spine, such as epidural steroid injection, or injecting material into the disc itself that will supposedly repair the disc. I can tell you, we used to perform these treatments and they don't work. They either don't work or they don't last. And if they do work, they work temporarily, and they're associated with a high complication rate. For example, laminectomy is highly invasive. There's destruction of muscle and bone and ligament in your spine. When the surgeon removes the bones and ligaments out of your spine, it creates tremendous amount of scar tissue and instability of the spine. Patients frequently come back needing spinal fusion. Patients with laminectomy are often in chronic back pain for the rest of their life, going in and out of pain management, on and off of pain pills, and in and out of physical therapy. They frequently require multiple surgeries in order to feel some type of pain relief. An alternative treatment is called a microdiscectomy. Microdiscectomy is another invasive procedure where the surgeon is removing bones and ligaments to get down to a herniated disc that's pinching a nerve root. Microdiscectomy is not a treatment for back pain. It is only recommended for leg weakness, leg numbness, and leg pain. Microdiscectomy does not fix back pain and should be avoided if you have back pain. Laminectomy does not fix back pain and should be avoided if you have back pain. Spinal fusion is a treatment for back pain. The surgeon must either remove or fuse the disc using hardware such as screws, rods, and bone graft, including cadaver bone graft. You're receiving biological bone graft from a dead person. That's what's allowing your bones to fuse together. Now, these spinal fusions can be quite effective at eliminating discogenic back pain, which is the type of back pain that you have. However, they carry a very high risk of complications. Complications such as blood clots in your legs, which could migrate to your lung and kill you in a process called pulmonary embolism. They also have a high risk of infection. Every patient that does a fusion requires postoperative narcotic opioid pain medication. Opioids are known to be dangerous, addictive, and have a high potential for abuse. You don't want to start opioid painkillers if you can avoid it. With the Duke laser disc repair procedure that we have recommended for you, there is no need for postoperative opioids. Our patients are treated with a small 7mm incision. That incision has minimal to no bleeding, and it heals within a few days. There is no need for narcotic painkillers. If you have the Duke laser disc repair, we can fix the back pain within 3 days coming from your damaged disc. We recommend you talk to our schedulers. They'll answer any additional questions you have. We'd love to see you here at Duke Spine Institute and provide you with the highest quality, most advanced treatment in the world that gives you the safest, most effective outcome in the world that lasts a lifetime. Thank you for listening. Welcome back. You can see that all those invasive surgeries that are being offered to patients like you guys with back pain, they're highly invasive, destructive of your body, destructive of your soft tissues, and in the end, the patients are no better off with their pain than they were having the surgery. Usually they're worse because that surgery takes away muscles, ligaments, tendons, bone that your body needs. So my advice, avoid invasive spine surgery. Avoid harming yourself. Get the less invasive, better treatments that are now available at Duke Spine Institute. Save yourself from suffering from complications that are very common with those invasive surgeries. All right, we started this disc off. We saw a massive amount of inflammatory tissue, and there it is right there. You guys can see it. We're at the back of the disc. There's tons of that pink stuff. That is granulation tissue, spelled Granulation. Granulation tissue. If you read about it, you'll understand what granulation tissue is. It happens with inflammation, and the more chronic inflammation there is, the more granulation tissue there is. That's what this patient has. Lots and lots of inflammation in these two discs that we're repairing. L1-2, L2-3, just above and adjacent to his prior fusion. Grab her. I'm going to show you all in a minute a huge herniation that we took out of this disc. There's another one right there. I'll put them side by side so you guys can see them. It's pretty cool. There's a little bit more, not too big. Any questions?
Yes, we have a couple questions. Next one is coming from, loving the name, Ribeye Ranger on YouTube.
Ribeye Ranger. That's funny.
I love it. It's great. Saying, hi, Doc. Love these videos.
Hey.
Question. Why
Sure.
pull pieces from the site instead of dissolving or ablating with a laser? I need lumbar evaluation for foraminal stenosis. Appointment pending, but I have eased much back pain by reducing my metabolic inflammation through a carnivore diet, 2.5 years, 67 years old, male, and lost 50 pounds.
Hey, cool. So, great question. The answer is we cannot possibly laser the entire piece of herniation away. It would take 10 hours. What we do is we release the herniation from the wall that it's the torn wall of the annulus that it's stuck to. And it's stuck there because when the herniation got into the wall in the first place, the wall reacted to it. It grabbed onto it, started inflaming it, scarring it, and then those pieces of herniation are just scarred to the wall. And we use the laser to remove that scarry attachment, that anchor that's holding down the herniation. And then we use the grabber to take out the herniation. If I just went in and zapped each of those pieces of herniation to death, that would take literally an hour per herniation, times 30. That would be 30 hours of surgery. No human being can do 30 hours. It just doesn't make sense. All right, that would be just not a good idea, really, really bad. So the way we do the surgery is I release these things and I pull them out. But I can't pull them out if I don't release them. They just don't come out. The grabber will grab, but it won't pull. It's like you trying to pull a bull out of a pen. You can grab the bull by the horns, but that bull is far more stronger than you, and you're not going to move it. And that's the problem, is these herniations are tough and they're scarred down, and the grabber can't pull them out. The grabber can only get the loose ones out. And so the grabber is limited in its ability to really grab on and pull. You just can't. All right, you need a laser. So it's a 1-2. You know, it requires both tools, laser plus grabber. Grabber, by grabber I mean the pituitary. All right, I'm done here. I'm going to leave this tube in, and I'm going to go to the other side and place my dilator. Because the disc is so collapsed, I'm going to use this tube to help get in. But before I do that, I'm going to take one more peek. I'm going to show you some of the herniations I took out of this L2-3. Let's get the light on for a minute. There's even more coming still. You guys see that?
Yes,
Show
we
them
do.
the herniations. Show them the herniations, Henry.
Copy
You
that.
guys see it?
Yes, we do.
And that's not all from this disc. We have more, but those are the bigger pieces that we sort of saved just to show you guys. All right. We are just outside that disc right now, and I can't get any more herniation. So I'm going to just stay right here. I think actually I'm out, so there's not much I can do for the dilator. Okay. Any questions?
Yes, we have a question coming from Melissa on YouTube,
Hi, Melissa. Welcome.
asking, where are you located for surgery? I have lordosis radiculopathy and also a slightly broken tailbone.
We are in Florida, and yes, it is worth it to come here for two reasons. One, get the right treatment for your problem. Lots of doctors just do laminectomies, fusions, discectomies, even though they don't know if it's going to help you. We know our treatments work because we make the right diagnosis first. I would do a Zoom call. We offer, no, it's out. We offer a free Zoom call to anybody who wants it to make a diagnosis. We offer that service for free. We don't charge for it. All you have to do is look down below in the chat box, and Henry's going to put the link for the free MRI review. What that is you submit your MRI images so I can look at them, and then I meet with you on Zoom and basically do a quick examination like of your back, and I can tell you exactly where your pain's coming from. Whether it's your tailbone, your disc, your facet, your SI joint, your piriformis, I will tell you exactly where your pain's coming from. And not just one spot. If you have 3 sources of pain, I'll tell you all 3. I could do that over Zoom. All I need is for you to show me where you're having your pain, be able to point it out. Plus, I'm going to ask you to push on some areas of your back and tell me where it's tender. All right? If you can do that for me, it usually takes about 2 minutes. That plus review the MRI, I'll tell you exactly why you're having pain. More importantly, we also have the cure for each type of pain. Doesn't matter what pain you have in your back. Disc, we do laser. Facet, we do plasma. SI joint, we do plasma. Piriformis, we do the release. Okay? And then for fractures of the bone, we do kyphoplasty. So 99.5% of chronic back pain is one of those 5 things, or a combination. Disc, facet, SI, piriformis, or fracture. Tumors, infections are rare, very rare, and they account for less than 0.5%. So 99+% of your back pain I can diagnose over Zoom with an MRI images that you give me, plus an exam, and 99.5% of back pain I can cure with our treatments here at Duke Spine. I don't do tumors. I can do infections of the disc, but I don't treat osteomyelitis or epidural abscess. I mean, I could if I had to. I don't want to because it gets complicated. If you're getting long-term antibiotics for those infections, you're going to need about 3 months of antibiotics plus infectious disease consultation. You got to do that at home, where you live, not in Florida if you live somewhere else. So treating those conditions are complicated. Same thing with tumors. Can I take tumors out? Absolutely. I'm a neurosurgeon. Do I want to take a tumor out of a patient who's traveling here? No. Why? Because when you have a tumor in your spine, it always requires these adjuvant treatments like radiation, chemo, and other treatments which we don't offer. Yes. Okay, that's why I don't like to treat tumors. Shot. All right, last disc. We're going back in to the one we were just in, but we were on the left side, now we're on the right side. Why are we doing both sides? Because he's got pinched nerves on both sides at L2-3 in the foramen. You could see it on the MRI. She's got a disc osteophytes in the neuroforamen, and they're crushing his nerves. He's got leg symptoms. Good. Any other questions?
Yes, we have a question from Lanu on YouTube.
Yes, Lana.
It's a question for me, asking, Henry, do you keep track of the rating or viewership on the Spine Scam movie? The first 2 weeks when it was initially released, yes, I did and all, but then a bunch of work and other stuff just happened, and I had my priorities had to be focused on other things. So, but regardless, yes.
Spine Scam movie, folks, exposes the spine industry. It's the first of a series. The only way we're going to do the entire series is if it gets picked up by a streamer like Netflix or HBO. They will pick it up if we get about 2 million views, okay? So we need people to go to YouTube, go to Spine Scam, watch the movie, and that way we can produce the other movies. We don't get any money, it's free, but I paid for Spine Scam out of my own pocket to raise awareness and teach the public about the problems in the spine industry that I am aware of exist and that are working against the public, that are harming patients. But it's really about 8 or 10 movies that need to be made. But I'm not going to fund all 10 movies out of my pocket. I was generous enough to pay for 1. I'm not paying for 2. So if you guys want more truth, then you got to get the support out there. You got to get viewership, people to watch the movie. It's free. It's a 2-hour movie, and it's a pilot in a series that we want to do to expose the insurance companies in the United States, to expose the implant companies, pain management doctors, pain management implant companies, and the electronic medical record systems that are corrupt and stealing money out of the healthcare system that should be going towards patient care. So there's a lot for us to expose, but it won't happen without your support. We're not asking for money, we're asking for views. We need 2 million views, is what I've heard. So 2 million views gets you guys more movies. Spine scans. Henry, why don't you put the link up
Already did?
so our audience can see? It's actually a very entertaining movie. People that watch it like it. And like I said, it exposes what's really happening in the spine industry. The same thing's happening in the orthopedic industry, the pain management industry, as it is in the spine. And by the way, it's also happening in other fields, like ENT, OBGYN. The OBGYN, the big scam are these bladder stimulators that these companies are pushing doctors to put in patients, and the doctors are getting huge payments. Huge payments. Like, they're making millions of dollars a year putting these stimulators in old ladies with incontinence, and they don't work. And the insurance companies are paying for it because they've basically figured out a way to get the insurance companies to pay. But these things don't work, unfortunately. And people are getting these dangerous procedures, getting these devices put in their body that don't even work. And the doctors are making gazillions of dollars. The companies making the stimulators are making gazillions of dollars. The hospitals make gazillions of dollars. Surgery center makes gazillions of dollars. And the person who suffers is the patient. And that shouldn't be that way. Medicine is all fucked up right now. It needs to be fixed, but it won't be fixed by anyone but the patients. Because all these other people, we call them stakeholders, they have a stake. Like, they have a stake in these procedures being done. Okay? That means they get money as the procedures are being done that are not helping patients. I have 2 minutes left on this disc. Then we're going to go to his facets if Dr. Berndes gives me the green light. Got the green light. So we're going to do this disc. I got 2 minutes. Almost done. He's not moving. Two minutes. And then I'm going to go do his facets as a separate stream. So get your last few questions in right now as I finish this disc repair at right side L2-3. Any other questions, Han?
At this moment, no current questions.
Right.
But we do have a comment coming from Ribeye Ranger regarding his lumbar evaluation, saying, "Wow, fascinating. Thank you for the clarification."
You got it. Ribeye Ranger. That would be a great, the old American superhero, underdog, Transformers, He-Man, Ribeye Ranger.
Texas Roadhouse mascot.
Texas Roadhouse. Is Texas Roadhouse called you? They want you to be their spokesperson. But I don't know. It sounds like he's not eating red meat anymore. I think he's not eating red meat because I think there's a big movement against eating meat because it's pro-inflammatory is what I'm hearing. So I think there's a lot of people who stopped eating red meats because they're inflammatory. Could be wrong, but I think that might be the case. All right, this is the last bit of that herniation right here that was pushing on his nerve on this right side. I just want to get out as much as we can. People ask me, Dr. Duke, how do you know you got it all out? Well, I already know I didn't get it all out because there's no way to get all of the herniation out. It's not possible. we surgeons cannot remove 100% of any herniation. There's always going to be a herniation left behind because of anatomy. The patient's normal anatomy blocks us from getting all of it out of there. It's just not possible to get it all. It's kind of like when you go to the arcade. If you've ever played that game where you have a bucket of coins, quarters, dimes, nickels, and they say put your hand in there and grab out as much as you can, right? And you put your hand and you try to grab it all, but you can't get it all. You can only get some of it. You try to get as many quarters as you can. Well, that's what we're doing. Can't get all the herniation. God won't let us. What we can do is get as much of the high value stuff as we can get. And that's what we do with the Duke Laser Disc Repair. And I remember growing up as a kid, went to Thousand Oaks Baptist School, and if you won the fundraiser for the school, if you brought in the most money, then they had this bucket of quarters, dimes, and nickels. And you would get one grab if you had brought in the most money on the fundraiser. They give you a grab. And it was always funny because the people that won, sometimes they had really small hands. And they were always trying to grab out as much change as they could, you know, with that tiny little hand. And you can see it though. It doesn't matter how small your hand is. Let me have the laser. Everyone does the same thing. They all look for where are the most quarters in that, on that surface, you know, and they go for it. Human nature.
We got about 5 minutes here.
I'm done. I'm done. Done with this disc. Coming out in 30 seconds. Huh? All right, we're done.
We do have one more question
Take it and then we'll be done.
from Lanu once more on YouTube asking, may I ask what is the average temperature in the surgical room? Thank you.
66 degrees. 66 degrees. It's clogged. It's clogged. 66 degrees with what? 66% humidity? Lower? 64?
Less than 60.
Look at this. They're getting all bent out of shape. What are you talking about? We get that humidity down for you. All right. 66 with 56 humidity. There you go. Oh, please. Come on now. Jordan, you're making that up. Oh, so that's with the new air conditioner. That's why. Ah, with the old one, it was warmer and more humid. Scope use 8. Thanks. All right, guys, we're done with this. We're going to be back with our Duke plasma rhizotomy for facet pain.